The number of patients suffering from fatty liver disease has significantly increased in recent years. But what is the cause of fatty liver and who are more prone to fatty liver disease? Are you concerned about developing fatty liver yourself or in your family members? If you want to know whether you or your family members are susceptible to this disease or not, stay with us in this article. Fatty liver is one of the most common metabolic disorders worldwide, which has relatively increased in prevalence in recent years. This disease occurs due to the accumulation of fat in liver cells and, if left untreated, it can lead to dangerous conditions such as cirrhosis and liver cancer. 1. Obesity, and overweight are significant factors in developing fatty liver. Excessive obesity not only correlates with fatty liver, but also with other diseases such as heart disease, cancer, and type 2 diabetes. Nowadays, due to unhealthy lifestyles and diets, obesity has become a dilemma. In addition to unhealthy foods, factors such as stress, lack of sleep, hormonal problems, and insufficient physical activity contribute to weight gain. Obesity leads to the progression of inflammation and conversion of non-alcoholic fatty liver to liver inflammation, which leads to the irreversible stage of this disease. Even for individuals with normal weight, if the fat around their abdomen exceeds healthy limits, they are at risk of fatty liver disease and should pay attention to its symptoms. Sugary drinks, due to high sugar consumption, are one of the most harmful dietary factors in causing fatty liver disease. Our bodies convert various sugars into glucose, which is used as fuel for organ function. But the problem is that the body converts excess glucose into fat, and this excess fat is stored in the liver. If your body mass index, BMI, is between 25 and 30, you are overweight, and if it is above 30, you are considered obese. According to research, individuals with excess fat around their abdomen and hips are more at risk of developing fatty liver than other obese individuals, and this problem can be a cause of fatty liver. Therefore, it is necessary to reduce the size of your waistline. Try to lose weight through a healthy diet and daily exercise. Weight loss has a significant impact on preventing fatty liver. 2. Diabetes. One of the most important causes of fatty liver disease is diabetes or abnormal blood sugar elevation. Diabetes or sugar disease is one of the common diseases worldwide. If the blood glucose level is abnormally high due to various reasons, diabetes occurs with symptoms such as excessive urination, excessive thirst, drinking a lot of fluids to relieve severe thirst, and excessive fatigue. Diabetes occurs for two reasons in the body. One is a disorder or deficiency in the hormone insulin, which is secreted from the human pancreatic gland, and the other is a disorder in the absorption and consumption of insulin by body cells due to resistance to it. Type 2 diabetes is a chronic disease that causes an increase in blood sugar. In this disease, the body does not respond to insulin adequately. Insulin delivers glucose to cells for energy. In advanced stages of type 2 diabetes, the body does not produce enough insulin and glucose accumulates in the blood. Type 2 diabetes is usually genetic, and sometimes obesity also affects it. This disease can be the cause of fatty liver and one of the risk factors for this condition. If you experience symptoms of diabetes such as lack of energy, excessive thirst, frequent urination, or blurred vision, be sure to see a doctor for diabetes testing. If diabetes is not well controlled, it can cause multiple complications for the body. One of these complications is fatty liver. Fatty liver is not common in type 1 diabetes, but is seen in half of the patients with type 2 diabetes. The reason for fat secretion in the liver of patients with type 2 diabetes is the increase in fatty acids from food and the metabolism of starches into fatty acids. Diabetes is a disease that is currently not curable but controllable. By controlling this disease, its complications can be prevented. The goal of treating this disease is to maintain blood sugar in the normal range, and one of the treatment methods is controlling the diet. If you are overweight, physically inactive, and have a history of diabetes in your family, especially your parents, you are at risk of developing fatty liver. 3. Genetics. Fatty liver disease can be hereditary, and its gene can be passed among family members. However, the gene related to this disease is still unknown. Genetic problems in some individuals make them more sensitive to fat accumulation in the liver. About 30% of the differences in fat accumulation in the liver are related to these genetic mutations. These mutations sometimes cause fatty liver disease. Some of these genetic factors are related to how the body metabolizes and stores fat, and some are associated with insulin resistance, a condition that often precedes NAFLD and exacerbates it. Individuals carrying these genetic variants may be more susceptible to NAFLD even in the absence of significant alcohol consumption. On the other hand, alcoholic fatty liver disease, AFLD, also has a genetic component that can influence an individual's susceptibility to this condition. Some genetic changes can affect how the body processes and detoxifies alcohol. Individuals with genetic factors that disrupt alcohol metabolism may be at high risk of liver damage from alcohol consumption, including developing AFLD. In addition to predisposing individuals to fatty liver disease, genetic role goes beyond. It can also affect the severity and progression of the disease. Some genetic types are associated with more aggressive forms of this disease, which can potentially lead to advanced stages of liver fibrosis, cirrhosis, or other complications. 4. High blood lipids. Elevated blood lipids, including triglycerides, can increase the likelihood of developing fatty liver. This condition can be hereditary. However, contemporary lifestyles, including unhealthy diets and very little physical activity, are among the reasons for elevated blood triglycerides. If your triglyceride levels are high, you should change your lifestyle because this condition can be the cause of fatty liver, stroke, or heart attack. High cholesterol is a common condition, especially in developed areas. When the amount of this fat increases in the blood, it accumulates in the walls of blood vessels and forms plaques. Over time, these plaques enlarge and block blood flow. One type of high cholesterol is familial and its genes are inherited. However, another type is acquired, and conditions such as lifestyle, underlying diseases, and medications affect its occurrence. High cholesterol levels in blood tests are dangerous and should be treated because this condition can be the cause of fatty liver. 5. Specific medication use. The use of certain medications can have serious side effects. For this reason, for long-term use, you must consult with a doctor. Prescribed medications such as amiodarone, diuretics, tamoxifen, and steroids can increase the risk of fatty liver. Various types of medications can affect liver enzymes. Some of the most common drugs include these prescribed medications can increase liver enzymes, including pain relievers such as aspirin, acetaminophen, and ibuprofen, anticonvulsants such as phenytoin, valproic acid, and carbamazepine, antibiotics such as tetracycline, sulfonamide, and isoniazid, cholesterol-lowering drugs such as statins, cardiovascular drugs such as hydralazine, tricyclic antidepressants. 6. Alcohol consumption. Excessive alcohol consumption leads to alcoholic fatty liver disease. Individuals addicted to alcoholic beverages are at risk of fatty liver and liver failure. The liver breaks down most of the alcohol and removes it from the body. However, the breakdown process produces harmful substances. These substances damage liver cells and cause inflammation of this organ. This disease can eventually progress to alcoholic hepatitis and cirrhosis. Studies have shown that simultaneous consumption of alcohol and fatty foods exacerbates this condition. Fatty liver is commonly seen after consuming small or large amounts of alcohol, even for a short period. Fat deposition in the liver can cause fatigue, weakness, loss of appetite, nausea, discomfort in the abdomen, and liver enlargement. In severe cases, jaundice also occurs. It should be noted that ignoring the need to quit alcohol consumption can lead to serious liver damage. If you found this video informative or thought-provoking, please consider giving it a like and sharing it with your friends and family. Let's work together to break the silence surrounding liver health and ensure that everyone has access to the information they need to lead healthier lives. Thank you once again for watching, and until next time, take care and prioritize your well-being.